Welcome to the World Health Summit. COVID-19 is a colossal challenge to global health. Nations where political decisions are backed up by science are having more success at mastering the crisis. But medical innovation and global cooperation are key to overcoming the coronavirus pandemic. And in the future, other potential pandemics are lurking on the horizon. We'll have to prepare. Digital tools and artificial intelligence are helping. But only international institutions can react to global threats in truly effective ways. We need a WHO with more power and better funding. Germany took on the presidency of the Council of the European Union in July. The crisis could help strengthen the bloc. At the same time, the EU is seeking more responsibility on the global health stage through more investment in the development of health systems all over the planet. And by continuing to play a leading role in implementing the United Nations Sustainable Development Goals, which, among other priorities, include measures to battle climate change and its consequences. The fight for a carbon-neutral future is also a fight for human health. The World Health Summit is an interdisciplinary forum that encourages international collaboration in the drive to find solutions to global health threats. Health is the greatest wealth. Global health in the 21st century. In Berlin and online. The World Health Summit 2020.
Yes, indeed. Excellencies, ladies and gentlemen, dear friends, health is the greatest wealth. Welcome to the World Health Summit 2020. Seien Sie alle herzlich willkommen. I am Detlef Ganten. Bienvenue à vous tous. Benvindo. Salam alaikum. Shalom. Also on behalf of the World Health Summit's academic backbone, the M8 Alliance, a wonderful network of 30 prestigious international academic health centers and universities around the world, and more than 140 national academies of medicine, engineering, and science. I welcome you also in the name of my co-president of the World Health Summit 2020, Professor Charles Ibingira from Kampala, Uganda, who unfortunately, for understandable reasons, could not come to Berlin. Excellencies, ladies and gentlemen, dear friends, the COVID-19 pandemic is making it clear that that solutions can only be found by overcoming personal, institutional, national interests. More than ever, the name of the game is international cooperation and solidarity. In complete academic freedom and independence, we from academia invite participants from all over the world, from politics, international institutions, the United Nations family, the World Health Organization, civil society, the private sector, to work together and to seek science-based solutions to the world's most challenging problems. In these days, the COVID-19 pandemic has to be our priority. The new coronavirus threatens the health and the life of everybody. The numbers of infections are increasing as we speak at a dangerous speed. The medical and health systems in many countries are not able to respond adequately. The world economy is suffering. Millions of people lose their jobs. Children drop out of schools. Violence is rising, and social cohesion is at risk. What is happening? A tiny little RNA SARS coronavirus, two of the family of other human coronaviruses, including SARS and MERS, a virus 120 nanometers small, with only 30,000 nucleotide building blocks in the genes. We humans, we have 3 billion contained in the droplets of infected people as they speak, sing, or sneeze. This small virus crosses the border of nations and continents and threatens to paralyze the world. But we have made progress. We have a better understanding of the virus. We can detect and precisely monitor infection. Simple hygienic measures like keeping physical distance, not social, washing our hands, wearing a face mask, and of course, lüften, the new German word of the rooms, lüften of the rooms, fresh air is important and will help to curb the spread of COVID-19. This requires participation, cooperation, and solidarity of everybody. We are also making scientific progress. About 100 years ago, diphtheria was a deadly disease, killing up to 50% of the children. Emil von Behring developed the first antiserum and vaccination here at the Charité in Berlin, and in 1901 received the first Nobel Prize for medicine ever. Now, diphtheria and many other diseases like measles, tetanus, poliomyelitis, and others are eradicated. Flu, Ebola, and HIV/AIDS, and many other diseases can be controlled, treated, and sometimes prevented. The goal is to look at what is known about the new virus, to do research and learn more, and to seek for solutions. These may be preliminary, as our knowledge is limited. Solutions can only be found by completely open, free, transparent investigation and discussion. Science is able to find out facts and to provide answers and more precise questions. This is a constant process. Self-criticism and criticism at any time is the basis of this scientific process and of any real advances. Every result will raise new vistas and necessitate new research, but hopefully will also provide the basis for new recommendations and solutions. There is justified hope for vaccination, treatment, and prevention of COVID-19. Admittedly, this is a complex issue. The challenge of the future is to cope with this complexity. Politicians have the difficult task to translate recommendations into actions and eventually into laws. Medical problems will develop into problems of health, into problems of economy, social, political, and culture. Politicians have no easy job, especially if people and society are scared and insecure and seduced to simplistic, fake answers. This is the reason why information and education is so essential. Educated people will be eager to be informed and try to understand. Education is the best vaccination against disease, but also against wrong prophets and false or simplistic information. We have to look ahead and prepare for the future. This is not the first pandemic, and recommendations for such situations were already on the desk or in the drawers of people in charge of such situations. We could have been better prepared if they would have been implemented. Prevention is not so popular because it is not spectacular in many cases and it costs money. Now we see that no prevention is a mistake and much more costly. We also have to be aware that other factors defined in the UN Sustainable Development Goals, like climate change, food and nutrition, political instability, war and conflict, fight and migration, are contributing to health problems. At the same time, the world's population continues to grow and to age. We strongly advocate a holistic and science-driven approach to solving these global challenges to health. We do need a holistic view on health, which includes our biology, our environment, and also our lifestyle. One Health and Planetary Health, the 17 Sustainable Development Goals, the SDGs, provide such a holistic framework. Health in all policies implies that policymakers across different fields take into account the health implications in their decisions, seek synergies, and avoid harmful health impacts. We have not reached this point. Improving global health requires efforts from all of us. It is essential that stakeholders from academia, politics, the private sector, and civil society work together and contribute to the common goal. Excellencies, ladies and gentlemen, dear friends, let's look forward. Due to the worsening situation in the COVID-19 pandemic, this year, 2020, the World Health Summit is being held exclusively in digital form. This enables worldwide participation, active involvement, and even wider outreach. I'm sure we shall come out of the World Health Summit 2020 with new energy and with new inspiration to work together and to improve health and well-being for all, our common noble goal. The World Health Summit, as a leading meeting on global health, is more important today than ever. Thank you very much for listening. Excellencies, ladies and gentlemen, dear friends, we are extremely thankful that great and influential leaders from politics, from international organizations, from civil society, and from the private sector have agreed to open the World Health Summit 2020. I'm now very honored to announce the message of the President of the Federal Republic of Germany, His Excellency Frank-Walter Steinmeier. Frank-Walter Steinmeier has had all important political positions in this republic. 2014, when he was Minister of Foreign Affairs, he had the foresight to invite the World Health Summit into the Ministry of Foreign Affairs. It was the time of the Ebola crisis in West Africa, and I shall never forget the moment when, after the opening lectures on genome editing, he asked me the question, is this basic research really that important for global health? Now we are all convinced the COVID-19 pandemic shows again how closely the science of virology is linked to global health. Ladies and gentlemen, we are proud and happy to hear the message of the President of the Federal Republic, Frank-Walter Steinmeier.
Exzellenzen, verehrte Ehrengäste, meine sehr verehrten Damen und Herren! Das hatte sich heute Professor Ganten eigentlich ganz anders vorgestellt. Hier im Zentrum Berlins sollte die Weltgemeinschaften der Gesundheitsexperten zusammenkommen. Mediziner, Unternehmer, Politiker, Vertreter internationaler Organisationen versammelt zu einer Konferenz, die wie kein World Health Summit vorher eine breite öffentliche Aufmerksamkeit auf sich zieht. Stattdessen muss in letzter Minute improvisiert werden. Die neuerliche Dynamik der Pandemie zwingt uns alle zu Einschränkungen. Zu viele Teilnehmer konnten nicht anreisen und doch ist, wenn auch nur über Bildschirme zusammengeschaltet, eine Weltgemeinschaft versammelt. Vielleicht liegt ja in dieser scheinbar paradoxen Situation eines World Health Summit, der noch nie so wichtig war und doch noch nie so wenige Menschen physisch versammelt hat wie in diesem Jahr, vielleicht liegt in dieser paradoxen Situation ein Schlüssel zum Verständnis unserer Lage in Zeiten von Covid-19. Schon zu Beginn dieses Jahres haben Staaten ihre Grenzen geschlossen, als das Virus sich ausbreitete. Wir haben das öffentliche Leben fast auf Null heruntergefahren, um die Dynamik des Infektionsgeschehens zu brechen. Wir alle wissen um die vielen Opfer dieser Wochen, bei vielen unserer Nachbarn noch mehr als bei uns. Das Virus hat dann über den Sommer vor allem anderswo auf der Welt gewütet. Nun ist es mit Macht zurück in Europa. Regierungen ringen in diesen Tagen um die richtigen Maßnahmen, einen zweiten Lockdown und eine erneute, unkontrollierte Ausbreitung des Virus zu verhindern. Wir alle werden mit schmerzhaften Einschränkungen leben, Disziplin üben und Geduld haben müssen. Geduld, die in den zweiten 6 Monaten eines langen Jahres noch einmal unendlich viel schwerer fällt als in den ersten 6 Monaten. Und zugleich wissen wir, dass diese Einschränkungen, diese Rückzüge hinter nationale Grenzen nicht die Lösung bringen für unsere schwierige Lage. Im Gegenteil. Der wirkliche Ausweg aus der Pandemie, der Silberstreif am Horizont unserer endlichen Geduld, liegt in der beispiellosen internationalen Anstrengung, in der Sie alle und noch viel mehr Menschen rund um den Globus vereint sind. Forscherinnen und Forscher in Universitäten, Unternehmen und Instituten, Unternehmer und Manager in der Pharmaindustrie, Beamte und Politiker in Ministerien und in internationalen Institutionen, Philanthropen und Experten, die 7 Tage in der Woche rund um die Uhr an Therapeutika und Diagnoseverfahren arbeiten, die Fabriken bauen für die ersehnten Impfstoffe, die unendlich komplizierte Logistik der Produktion und weltweiten Verteilung austüfteln. Deshalb freue ich mich, dass Sie alle hier virtuell zusammenkommen heute Abend und für die nächsten Tage. In diesem Sinne, herzlich willkommen in Berlin. Meine Damen und Herren, ja, ich weiß, manche sehen unser global vernetztes Wirtschaftssystem nun als Fluch. Ein System, dessen Schwäche und Verwundbarkeit in der rasenden Ausbreitung des Virus bis in den hintersten Winkel plötzlich offenbar wird. Ich sehe aber zugleich noch etwas anderes. Ich sehe die Mobilisierung enormer Ressourcen und eines bewundernswerten menschlichen Erfindungsgeistes in einem wahrhaft weltumspannenden Netzwerk. Wohl nie zuvor ruhten die Erwartungen und Hoffnungen von mehr Menschen auf Ihnen, die Sie hier versammelt sind und zuhören. Ich gebe zu, auch meine. Aus vielen Gesprächen mit Experten ziehe ich außerdem die begründete Zuversicht, dass wir in absehbarer Zeit greifbare Fortschritte sehen werden. Neue Testverfahren, die schnellere Ergebnisse bringen, neue Therapeutika, die schwere Krankheitsverläufe lindern, neue Impfstoffe, die sicher und wirksam sind. Sie wissen besser als ich, dass selbst solche Durchbrüche uns nicht von heute auf morgen die Normalität vor der Pandemie zurückbringen. Sie wissen besser als ich um die enormen, ja beispiellosen medizinischen, technischen und logistischen Herausforderungen der kommenden Monate. Und doch, all das macht mir Hoffnung, dass wir im kommenden Jahr Schritt für Schritt den Weg aus dieser Pandemie herausfinden. Meine Damen und Herren, Covid-19 fordert uns alle. Das Virus kennt keine Grenzen, die Nationalität seiner Opfer sind ihm gleichgültig. Es wird auch künftig jede Barriere überwinden, wenn wir ihm nicht gemeinsam entgegentreten. Im Angesicht des Virus sind wir zweifellos eine Weltgemeinschaft. Aber die entscheidende Frage ist doch, sind wir auch in der Lage, als eine solche zu handeln? Vor 6 Jahren, als ich diesen Gipfel schon einmal eröffnen durfte, war das beherrschende Thema damals die Ebola-Epidemie. Mit der Hilfe und den Mitteln vieler, auch vieler unter Ihnen, konnte damals der Ausbruch eingedämmt werden. Heute stehen wir vor einer ungleich größeren Herausforderung, medizinisch wie politisch. Wenn wir heute eine wirkliche globale Allianz schmieden müssen, dann nicht allein als Akt der Solidarität, nicht um ein Anliegen zu fördern, das nicht primär als das unsere verstanden wird, sondern auch aus einem wohlverstandenen Eigeninteresse heraus. Niemand ist sicher vor Covid-19, niemand ist sicher, bevor nicht alle davor sicher sind. Selbst wer das Virus in seinen eigenen nationalen Grenzen besiegt, bleibt ein Gefangener dieser Grenzen. Jedenfalls, solange es nicht überall besiegt ist. Selbst wer seine eigenen Fabriken wieder öffnen kann, braucht Zulieferer, braucht Partner, braucht Kunden jenseits seiner Grenzen. Eine Pandemie, die im eigenen Land eingedämmt, aber jenseits unserer Grenzen nicht überwunden ist, kostet weiterhin Menschenleben, kostet aber auch Wohlstand. Die Formel, wenn jeder an sich selbst denkt, ist an alle gedacht, ist nicht nur unethisch, sie ist dumm. Aber auch wenn das alles für uns klar auf der Hand liegt, bleibt die entscheidende Frage doch immer noch unbeantwortet: Schaffen wir es, wirklich als Weltgemeinschaft zu handeln? Dazu bedarf es mehr als nur der Einsicht. Ich bin der Europäischen Kommission unter Frau Van der Lion und dem WHO-Exekutivdirektor Tedros sehr dankbar für ihre führende Rolle, eine solche globale Allianz zu schmieden. Ebenso dem französischen Staatspräsidenten und der Bundeskanzlerin für ihre starke Unterstützung schon im Frühjahr zu Beginn der Pandemie, jedenfalls die Weichen richtig zu stellen. Ich bin den 168 Regierungen dankbar, die sich bis heute dem sogenannten Advanced Covid Tools Accelerator angeschlossen haben. Ich bin den Ländern, Unternehmen und Stiftungen dankbar, die sich in diesem Rahmen in der COVAX-Initiative engagieren. COVAX ist unsere beste Chance, einen weltweit fairen, transparenten und bezahlbaren Zugang zu Impfstoffen, Medikamenten und Diagnostik zu organisieren. Bis Ende 2021 sollen so über 90 Ländern mit mittleren und niedrigen Einkommen 2 Milliarden Impfdosen zur Verfügung gestellt werden. Doch der Finanzbedarf für Forschung, Entwicklung, Produktion und Verteilung ist bei weitem noch nicht gedeckt. Die Kosten für eine solche Kraftanstrengung sind enorm. Aber sie machen am Ende nur einen Bruchteil dessen aus, was die Regierungen schon heute für die Stabilisierung ihrer Volkswirtschaften und Sozialsysteme während der Pandemie ausgeben mussten. Das Geld für COVAX ist nicht nur aus medizinischen, auch aus wirtschaftlichen Gründen gut ausgegebenes Geld. Meine Damen und Herren, der sogenannte Impfstoffmoment, der uns im Falle erfolgreicher Forschung bevorsteht, ist, wer wüsste das nicht unter Ihnen, medizinisch und logistisch enorm komplex und herausfordernd. Überdies ist er auch politisch voller Risiken und eine Wegscheide. Es hängt von unserem Handeln heute ab, wie die Welt nach der Pandemie aussieht. Es hängt von den Regeln ab, auf die wir uns in diesen Wochen verpflichten, wie viele Menschenleben wir retten können. Es hängt von unserer Weisheit ab, ob sich die Logik der Zusammenarbeit und des kollektiven Handelns gegen egoistische Impulse und gegen geopolitisches Kalkül behaupten kann. Es liegt an uns, wie viel Vertrauen als wertvollste Ressource des Miteinanders unter den Staaten am Ende der Pandemie noch vorhanden ist. Kurz gesagt, es liegt an uns, den hehren Worten auch Taten folgen zu lassen. Das gilt schon innerhalb unserer Gesellschaften. Es muss ein Verteilungsschlüssel festgelegt werden, wer wird wann mit welcher Priorität geimpft. Vor allem in den Monaten, in denen noch nicht ausreichend Impfdosen zur Verfügung stehen, um alle zu impfen, die geimpft werden wollen. Medizinisches Personal, besondere Risikogruppen, ältere Menschen, sozial gefährdete Gruppen und wer noch? Konsens darüber herzustellen, wird alles andere als einfach. Aber erst recht auf der globalen Ebene. Es wäre eine Illusion zu glauben, dass schon kurz nach der ersten Zulassung genug Impfstoff zur Verfügung stehen wird, um sofort Milliarden von Menschen auf der ganzen Welt vor einer Infektion zu schützen. Wir alle wissen auch, dass Regierungen zuallererst ihrer eigenen Bevölkerung verpflichtet sind. Es ist deshalb zunächst verständlich, wenn Regierungen versuchen, sich schon jetzt vor der Zulassung eines oder mehrerer Impfstoffe größere Mengen davon bei den Herstellern zu reservieren. Aber zur Wahrheit gehört auch, weil nicht überall auf der Welt sofort Impfstoffe in großer Menge produziert werden können, wird eine solche frühzeitige Impfstoffsicherung einiger zulasten anderer gehen. Präziser ausgedrückt, fast die Hälfte der Weltbevölkerung lebt in Staaten, die nicht über die Mittel verfügen, sich den Herstellern als Vorzugskunden anzudienen. Die Folge wird sein, dass in ärmeren, aber nicht weniger bedürftigen Ländern nur ein geringer Teil der Bevölkerung geimpft werden kann. In reicheren Ländern hingegen ein ungleich größerer Teil. Wird es der Politik gelingen, überzeugend zu erklären, dass es für uns alle von Vorteil ist, wenn zunächst weniger Menschen in allen Ländern geimpft werden, als in wenigen Ländern alle Menschen? Das kann nur gelingen, wenn wir uns jetzt auf Regeln verpflichten, die dem Ziel, aus dem Impfstoff ein Global Public Good zu machen, so nah wie irgend möglich kommen. Das ist das Ziel, das sich COVAX und seine Unterstützer gesetzt haben. Um einen solchen, zugegebenermaßen ambitionierten Ansatz, der an das Beste in uns Menschen glaubt, um diesen Ansatz zum Erfolg zu führen, braucht es weltweite Unterstützung. Kein Land fehlt zum Erfolg der bisherigen Anstrengungen so sehr wie die Vereinigten Staaten von Amerika. Ich appelliere deshalb an die nächste Regierung der USA, wer immer sie ab dem 20. Januar stellen wird, sich der COVAX-Initiative anzuschließen. Ich appelliere an China, seinem Beitritt und seiner Rhetorik zu Impfstoffen als Global Public Good substanzielle Taten der Unterstützung für COVAX folgen zu lassen. Das wird auch in Chinas wohlverstandenem Eigeninteresse sein. Ich appelliere auch an alle Akteure der deutschen Bundesregierung, die in den COVAX gebündelten Bemühungen um weltweit fairen Zugang zu Impfstoffen und Medikamenten dieselbe Aufmerksamkeit und Unterstützung zukommen zu lassen, wie sie es mit ihrem bewundernswerten Einsatz für eine gemeinsame europäische Antwort auf die Krise tun. Meine Damen und Herren, es ist eine gewaltige Aufgabe, die zu leisten ist. Und doch, wenn wir auf das Jahr 2021 blicken, haben wir doch Anlass zu begründeter Zuversicht. Das ist die Zuversicht, die die weltweite Gemeinschaft der Forscher und Mediziner uns gibt. Aber wenn wir nach der Pandemie nicht in einer Welt leben wollen, in der der Grundsatz jeder gegen jeden und jeder für sich noch mehr Raum greift, dann brauchen wir die aufgeklärte Vernunft unserer Gesellschaften und unserer Regierungen. Dann müssen wir die Pandemie mit einem Geist der Zusammenarbeit überwinden, nicht im Geist des Impfstoffnationalismus. Selten in der Menschheitsgeschichte liegen die menschenrettenden und wohlstandssichernden Früchte internationaler Zusammenarbeit einerseits und die kalten Folgen einer Jeder-für-sich-Politik andererseits so offen zutage und vor unseren Augen wie in Zeiten der Covid-19-Pandemie. Wenn wir hier scheitern, wie können wir dann die Zuversicht bewahren, dass wir im Kampf gegen den ungleich komplexeren Klimawandel, dass wir diesen Kampf gewinnen können? Umgekehrt aber, wenn es uns im kommenden Jahr durch den menschlichen Erfindungsgeist und die beispiellose Anstrengung einer wirklichen Weltgemeinschaft gelingt, Covid-19 in die Schranken zu weisen, dann können wir mit neuem Optimismus daran gehen, auch auf den menschengemachten Klimawandel eine wirkungsvolle Antwort zu geben. Ich wünsche uns allen den Mut, die Vernunft und die Kraft, genau darauf hinzuarbeiten. Vielen Dank.
Thank you so much, President Steinmeier, for this important and thoughtful speech. Excellencies, ladies and gentlemen, dear friends, our next speaker and myself have a few things in common. We are both medical doctors. We started off in research, then worked on clinical problems, but then we both moved on to completely different professional activities. Ursula von der Lion is now one of the most well-known politicians in our country, in Germany, and in Europe. She is the president of the European Commission, and she is a high patron of the World Health Summit.
President Steinmeier, Secretary General Gutierrez, Dr. Tedros, distinguished guests, I'm honored to be a patron of this year's World Health Summit. And I'm delighted to be able to speak to you today, even if I wish it could be in person. Last year's edition, with more than 2,500 participants and 300 speakers from 100 nations, feels very difficult to imagine only 12 months on. This event has long reflected the global and interconnected nature of health in the 21st century. And looking back now, this is something I perhaps had not fully grasped as a student when I saw medicine primarily through a scientific lens. And while I started to understand it more as a doctor in obstetrics and gynecology, the nature of my work was still very narrowly focused on the clinical and the individual. It is important, but it was only later, when working at the Department of Epidemiology at the Hanover Medical School, that I really learned what global health meant. And there's one story from the time, the story of an epidemiologist, that I think illustrates this better than I could explain. It was back in February and March 2003, just as I was moving from medicine to become state minister with responsibility for health, amongst other things. At the exact same time, on the other side of the world, a SARS superspreading event was taking place on the 9th floor of the Metropole Hotel in Hong Kong. And within days, the virus had spread as far as Singapore, Canada, and Vietnam. And it was in Hanoi that Dr. Carlo Urbani, an infectious disease specialist, was working for the WHO. Here was an Italian doctor working in a French hospital in Vietnam, treating an American patient who himself had fallen sick in Hong Kong. He recognized at first that this was a SARS-like respiratory disease, and he was the first to trigger the alarm. And in doing so, he saved countless lives everywhere from Thailand to Toronto and probably far beyond. I mention this story firstly to pay tribute to Dr. Urbani, who, as many of you will know, became infected shortly afterwards and sadly passed away, leaving a young family behind. But also to illustrate how linked our health is and how important global cooperation is. More than at any point in human history, the health of one country directly affects that of another. And cross-border viruses need cross-border responses, especially as we move into the next phase of this pandemic. The dramatic spikes in recent weeks across the world, and especially here in Europe, reflect a picture that is getting worse by the day. So we are back to March and April levels, and in many cases already far beyond it. But while the virus is back stronger than ever, our knowledge and our experience of what we need to do is also much better than before. And I would like to focus on 3 areas where this will be critical in the next month ahead of us. The first is the need for coordination across borders. At the beginning of the pandemic, unilateral border closures threatened our ability to manage the health crisis and our ability to keep our societies and economies going. In response, we created green lanes to ensure the availability of goods and essential services. But this pointed to the crucial importance of early and effective cross-border cooperation. The virus does not respect any borders. And this is why the Commission last month set out how measures taken by member states should be coordinated and communicated. We now have common criteria and thresholds when deciding whether to introduce travel restrictions. We have a map with a single set of colors where everyone agrees which regions are red, orange or green. And we now need a single set of rules for what testing and quarantine people have to do if they are traveling from a high-risk zone. The second area where we need to draw on our experience is the supply of equipment. In response to shortages at the beginning of the pandemic, Europe took swift action to ensure that industry here in Europe could ramp up the production of masks, of gloves, tests, ventilators, and all the other essential equipment. We created a common European reserve for medical equipment, and through our civil protection mechanism, that's how we call it, we can now ensure that it is distributed to where it is needed most. Like, for example, the 30 ventilators that we are now sending to Czechia. Also, the need to diversify some of our supply chains in critical areas will be a key focus in the weeks and months and years ahead of us. In the meantime, we know that almost every country will take drastic and difficult measures to contain the spread of the virus, rightly so. People are once again being asked to make painful sacrifices. We owe it to them to all pull in the same direction, to protect their lives and their livelihoods. And this is the third area I would like to discuss. We need to ensure that we support people and that we support the economy. And this is why we created SURE. This is a temporary instrument to keep people in work and in the companies, in business. It will be funded by 100 billion euros, issued through social bonds. And it will now start supporting short-time work schemes in at least 16 member states. And in parallel, our recovery plan, we call it Next Generation EU, will finance 750 billion euros of investment and reform to kickstart our economy, to strengthen our health systems, and to accelerate Europe's twin green and digital transition. Ladies and gentlemen, the point is we cannot wait for the end of the pandemic to repair and prepare for the future. And this is why we will be putting forward proposals to improve our ability to collectively respond to serious cross-border health threats. We will strengthen our medicines and scientific agencies, the ECDC and EMA, and we will build a new European agency for biomedical advanced research and development. And we will build the foundation of a stronger European health union in which 27 countries work together to detect, prepare, and respond collectively. On the one hand, we have seen the limits of what Europe can do without competence in this area. And we do need to have a real debate on this. Because on the other hand, we have seen the real added value when countries cooperate and coordinate on everything from data to criteria. Only this week, the Commission has set up an EU-wide gateway for national tracing apps to ensure they safely interoperate and interact with each other. So tracing apps from Germany, Ireland and Italy, for example, are now linked to this gateway. And Czechia, Denmark, Latvia, Spain and many others will soon also follow. This will help people who work or travel across borders and ensure we are all pulling together. All pulling together. This must be the hallmark of the European Health Union. And I believe this can be a test case for a true global health compact. The need for leadership is clear. And I believe the European Union must assume this responsibility. And this is why I will convene a global health summit next year alongside Prime Minister Conte and the Italian G20 presidency. The aim will be to bring all global efforts together, to learn the lessons of the crisis, and to update global health cooperation for this age of pandemics. We really need to rally around a set of international commitments, investments and principles for the next decade of global health cooperation. And we have been laying the groundwork for this ever since the pandemic started. In April, the European Commission helped launch the ACT Accelerator Initiative, an initiative to globally coordinate and speed up the development and fair allocation of vaccines, treatments and diagnostics. Then in May, we brought more than 40 countries together to raise the necessary 16 billion euros, again for universal access to tests, treatments and vaccines, and to support the economic recovery of the world's most fragile regions and communities. And this was a truly global effort. It was supported by many, for example, Global Citizen, the Bill and Melinda Gates Foundation, the Wellcome Trust, the WHO, the Global Preparedness Monitoring Board, just to name some. And then in August, the European Commission joined the COVAX facility. It is co-hosted by Gavi and contributed 400 million euros for pooled procurement and equitable distribution of COVID-19 vaccines around the world. But we all know there is way more work to do. And we know that developing a vaccine won't save lives in itself, but vaccinations will. So we need to ensure that those who need them most urgently can get it first, the health workers, the vulnerable, the older generation. The European Commission has been working hard to make agreements with pharmaceutical companies and secure future doses. We must now get ready to deploy it, both in Europe with our recent vaccination strategy and, of course, around the world. And we will not stop once the first vaccinations have been administered, because way more important is that we will centrally collect robust data and robust evidence to assess the impact, the effectiveness, and any side effects of these vaccines. National immunization technical advisory groups will, in close cooperation with ECDC and the EMA, play a key role in the coordination of large-scale EU-wide studies that are monitoring the safety and the effectiveness of COVID-19 vaccines. Preparation for these activities must start now. They must start now to be in place when COVID-19 vaccines reach the European market. Ladies and gentlemen, only with trust and with transparency about the process will we overcome any doubts or disinformation. But for the longer term, I believe it is time for the world to change its mindset on health. We need to move away from looking after our health only through clinical individual outcomes. In today's world, we need to look after our health by looking after our planet, our well-being, and our sustainable development. And we need to do it together through global health cooperation and not through global health competition. And this is the aim of this conference. And this is what you can count on Europe for in the difficult period ahead and in the decade that follows. Thank you so much.
Thank you, President von der Leyen. It is wonderful to see how Europe comes out stronger from this crisis and how institutions grow together into a European health union. Thank you so much. It is now, Excellencies, ladies and gentlemen, dear friends, my great pleasure to introduce Antonio Gutierrez, the Secretary General of the United Nations. And I'm proud to say that he also has something in common with me. Both of us received an honorary doctorate from the famous Portuguese Coimbra University, one of the oldest and most prestigious universities in Europe, a member of the M8 Alliance. Excellencies, ladies and gentlemen, dear friends, please listen to the message of Antonio Gutierrez, Secretary General of the United Nations.
Excellencies, colleagues, friends, the COVID-19 pandemic is the greatest crisis of our age. Just 7 months since it was declared, over 1 million people have died and tens of millions have been infected. Cases are still rising, and new spikes and waves are occurring in places that had suppressed the virus for many months. The indirect impact of the pandemic is wreaking havoc on societies and economies. Travel restrictions and lockdowns have resulted in the loss of 500 million jobs so far and are costing the global economy some $375 billion every month. Reports of gender-based violence are skyrocketing. Mental illness is a crisis within a crisis. Deaths from other health conditions are likely to increase as resources are redirected towards COVID-19. Some 24 million children could drop out of school with lifelong impact. COVID-19 is driving us even further off course from achieving the vision and promise of the 2030 Agenda for Sustainable Development. Excellencies, colleagues, and friends, the first hard lesson of this crisis is that we were not prepared. Global health and emergency response systems have been tested and found wanting. Access to health is a human right denied to billions of people around the world. Universal health coverage is the path to high quality, equitable, affordable health care. Strong public health systems and emergency preparedness are essential steps to greater resilience. All countries have signed up to universal health coverage by 2030, but we cannot wait 10 years. We need health systems that work before we face an outbreak of something more contagious than COVID-19, more deadly, or both. Excellencies, ladies and gentlemen, the second lesson is that we are not powerless. If we follow the science and demonstrate unity and solidarity, we can overcome the pandemic. Public health measures, including masks, physical distancing, and hand washing, are a proven means of keeping the virus at bay. We need to protect the vulnerable, older people, and those with pre-existing conditions. We must stop holding and attending events that amplify the spread of the virus. And we must work with communities on sharing information and building trust. Numerous governments have demonstrated that taking targeted local measures immediately outbreaks occur can stamp them out. At the same time, we must persevere with comprehensive public health measures that the World Health Organization identified on day one. Find, isolate, test and care for cases, and trace and quarantine their contacts. Excellencies, ladies and gentlemen. Third, we need global solidarity every step of the way. Developed countries must support health systems in countries that are short of resources. And we must join together as governments, the private sector, civil society, and all partners to make sure vaccines, tests, and treatments are available to everyone, everywhere. A vaccine must be a global public good. Fully funding the ACT accelerator is the fastest way to end the pandemic. Vaccines, tests, and therapies are more than lifesavers. They are economy savers and society savers. There is no choice between saving people's lives and saving jobs. Protecting people from the virus is the best way to keep schools open and businesses running. It will prevent the virus from spreading even more widely and returning in wave after wave. But as I've said before, there is no panacea during a pandemic. Relief will come not through one single step, but through smart combining cutting-edge research with basic public health. Excellencies, colleagues, and friends, the fourth lesson is that misinformation and disinformation are deadly allies of the virus. They are contributing to deaths and infections, and to social tensions that have led to violence. Unless we counter rumors, conspiracy theories, and lies, they will negate our other efforts. The United Nations Verified campaign aims to ensure people have access to accurate advice that protects and promotes health. I welcome efforts by social media platforms and others to prevent the spread of false stories and advice and promote scientific fact-based analysis, although more must be done. Excellencies, ladies and gentlemen, the World Health Summit and the M8 Alliance are important platforms to champion and work together for global health. This gathering, bringing together science, politics, business, and civil society, is the place to build new partnerships, share best practices, and take decisions that could save lives. Let us use this opportunity to confront the COVID-19 crisis together with the urgency and integrity it requires. Thank you.
Thank you, Mr. Secretary General, for your constant support. Now, ladies and gentlemen, Excellencies, dear friends, it's a great pleasure and a privilege to introduce my good friend and also the patron of the World Health Summit, Dr. Tedros, Director General of the World Health Organization. Dr. Tedros is the first WHO Director General to have been elected from multiple candidates by the World Health Assembly, and he is the first from the African region. Needless to say to this audience that Dr. Tedros probably has one of the most important, but also one of the most challenging positions at the present time. He personally and WHO deserve our full support. Let us listen to his message.
Your Excellency Frank-Walter Steinmeier, Federal President of Germany, Professor Detlef Ganten, Excellencies, dear colleagues and friends, it's truly an honor to address you today. As a member of the World Health Summit's founding committee, and now as one of its patrons, I'm so pleased to see how it has evolved into a forum where a truly diverse group of global health leaders can come together to tackle the tough questions. I'm sad I cannot be in Berlin this year in person, but I'm happy we can convene virtually. We're indeed facing tough questions today. When I had the honor of addressing the World Health Summit a year ago, I spoke about the deficit in political will to act on global health and preparedness. Understandably, perhaps, both seemed like abstract concepts at the time, involving faraway events that happened to faraway people. Well, my friends, global health is no longer in abstraction. From Berlin to Bogota, Minneapolis to Mumbai, Seoul to St. Petersburg, we're facing the same threat, confronting the same difficult new reality. Of course, this pandemic is playing out differently in every country and in every community. But there are some constants. Health systems matter, preparedness matters, and doctors, nurses, and health workers must have the training and equipment they need. These have been fundamental to how countries and communities are weathering this pandemic. The lesson is clear. A strong health system is a resilient health system. Health systems and preparedness are not only an investment in the future, they are the foundation of our response today. Public health is more than medicine and science, and it's bigger than any individual. Ultimately, it's a matter of leadership and a question of political choice. COVID-19 is shining a light on the decisions we and our policy makers are making, not only today, but also in the past. Many of the world's wealthiest countries, with some of the most advanced health systems, have been upended by this virus. This virus thrives in the inequalities in our societies and the gaps in our health systems. The pandemic has highlighted the neglect of basic health system functions underpinning emergency preparedness to disastrous consequence. COVID-19 has put the spotlight on critical gaps in areas such as surveillance, diagnostics, essential medicines, protective equipment, supply chains, infection prevention and control, water, sanitation and hygiene, and the health workforce. The absence of any one of these leaves communities vulnerable and undermines the timely response necessary to contain the pandemic or any health crisis. But the pandemic has also given us cause for hope, because we have seen again and again that when countries and communities take the right actions, it's never too late to bring the outbreak under control. We know that fundamental public health measures work. Find, test, isolate, and care for every case, and trace and quarantine every contact. We know that we can slow the spread of the virus through physical distancing, masks, hand washing, and meeting family and friends outside. We have to do it all. And across the globe, we continue to see a resurgence of cases when countries reopen their societies and economies too quickly. This is a dangerous moment for many countries in the Northern Hemisphere as cases spike. But again and again, we have seen that taking the right actions quickly means the outbreak can be managed. In the face of this unprecedented threat, leaders must strike a delicate balance between protecting their people and maintaining essential health services while minimizing social and economic damage and respecting human rights. It's not enough to be reactive. We must plan and take action for this pandemic over the long haul. We have to move from ad hoc solutions to long-term planning to protect lives and livelihoods. And the health effects of the pandemic go far beyond the suffering caused by the virus itself. Vaccination campaigns for tuberculosis, pneumonia and diarrhea, polio, measles, and many others have been disrupted, putting hundreds of millions of people at risk. We must preserve and restart our prevention and treatment campaigns and other essential health services with the utmost urgency, while also assuring safe conditions for frontline workers and patients alike. We still have a long haul ahead of us. We cannot slow down and we cannot waver. It's more important than ever that we focus on the elderly and other vulnerable populations who already struggle to access health services, including migrants and other marginalized groups. We have a huge challenge ahead of us, but this is not the first challenge we have faced, and this will not be the last. We're learning the lessons of this pandemic every day. It's up to us to act on them. Last year, and since then, I have spoken many times about the importance of national unity and international cooperation, or global solidarity, of multilateralism and solidarity. Again, the pandemic has made these concepts concrete. They're literally matters of life and death. It's natural that countries want to protect their own citizens first. But if and when we have an effective vaccine, we must also use it effectively. And the best way to do that is to vaccinate some people in all countries rather than all people in some countries. I will repeat. The best way to do that is vaccinate some people in all countries rather than all people in some countries. Let me be clear. Vaccine nationalism will prolong the pandemic, not shorten it. The only way to recover faster, be it lives or livelihoods, is to recover together. This is why President Ursula Van Der Lion and President Emmanuel Macron joined with WHO to launch the Access to COVID-19 Tools Accelerator to scale up the development and delivery of safe and effective vaccines, treatments, and diagnostics to the world's most at-risk people in all countries. I also want to specially mention President Macron and Chancellor Angela Merkel, who have increased their commitment to support WHO's coordinating role in the global public health architecture. And I would like to give a special thanks to my close friend, His Excellency Jens Spahn, the Minister of Health of the Federal Republic of Germany, who has been a steadfast supporter of WHO's work and a champion for multilateral action and support for health. Jens, I wish you a quick recovery. Finally, I have the pleasure of announcing that together with the Global Governance Project, we're releasing a new publication entitled Health, A Political Choice, Act Now, Together. It includes national case studies on the response to COVID-19, insights from leaders, and addresses the economic, social, and ecological determinants underlying the pandemic. Excellencies, friends, and colleagues, how we emerge from this pandemic and whether we're ready to take on the challenges of the future depends on our actions today. Working together in solidarity, we can save lives, stabilize health systems, and drive a global recovery. And even as we respond to the current crisis, we have to be planning ahead for the long term. We must learn the lessons of today so that we're prepared for the threats of tomorrow. Vielen Dank. I thank you.
Vielen Dank, Dr. Tedros. Thank you very much, Director General of WHO. We heard your message, and we wish you good luck and courage. And hopefully we will achieve together with you what needs to be done in these challenging days. Our next speaker, Excellencies, ladies and gentlemen, dear friends, is Paul Hudson, CEO of Sanofi France. Paul has a splendid international career in healthcare. The success of the vaccination programs of Sanofi with their partners will be decisive for the course of the COVID-19 pandemic and will be decisive for our ability to treat the disease. Let us hear his message.
Good evening, guten Abend. I'm sorry I'm not able to be with you all in Berlin tonight. Whilst I regret not being with you physically, I'm delighted to be able to share some thoughts for the opening of the World Health Summit, a platform of exchange and conversations that has probably never been so important. The pandemic and related uncertainty we navigate through every day is showing us how vulnerable our interconnected world can be. Such global tragedy calls for a global response and mobilization from all stakeholders, academia, policymakers, civil society, and industry. In this context, and after 30 years working in the pharma industry, I can only say how impressed I've been by the mobilization of all of the health community. As Sanofi and industry, we have a strong sense of purpose to play our part. In the peak of the first wave, and despite the lockdown measures, all of our work has been stripped down to the bare essentials, making and supplying medicines to those that need them and protecting our science so that future life-changing medicines are not delayed. In parallel, since February, we have entered in a race against the virus with the ambition to do something that has never been done, developing a vaccine at an unprecedented speed without cutting corners on safety or efficacy. Multiple vaccines will be needed. The race is not between companies, it's against the virus. And I sometimes said that it is a race that I'm happy to lose as long as we can have multiple vaccines to help the world get back to normal. We are developing one of our vaccines in cooperation with our peer, GSK, tremendous partnership. We'll provide the antigen, they'll provide the adjuvant, and we will leverage a proven and approved platform used for our influenza vaccines. Finalizing our partnership with GSK took us only 12 days, and in normal times it would have taken us months, if not years. Our partnership with GSK exemplifies two essential ingredients of success in the global fight against the virus: speed and collaboration. Since February, we have been constantly engaging with our regulatory authorities to understand how we can accelerate the development of a vaccine by exchanging information in real time. Early in the crisis, we've been able to leverage our relationship with the US agency BARDA to accelerate the development of one of our vaccine candidates. Over the last weeks, we've also been able to conclude agreements with governments of the United States, the UK, the European Union, and Canada for the supply of vaccines should it be proved safe and effective. We also plan to provide a significant proportion of our total worldwide available supply to COVAX, a global collaboration platform which aim to accelerate the development, production, and equitable access to COVID-19 tests, treatments, and vaccines. One thing is certain, we are all taking all the necessary steps to ensure that COVID-19 vaccines will be affordable and accessible to people right across the world. Sanofi Pasteur's motto has been for decades that no one should die from a vaccine-preventable disease. Vaccines is part of Sanofi DNA. Polio, yellow fever, influenza. Every year our employees produce 1 billion doses of vaccines to prevent people catching diseases. COVID-19 gives us one more opportunity to play a key role for public health. As we continue fighting against the virus, we also have a responsibility to continue thinking long-term. We must ensure that we don't forget and capture the lessons we're learning in this crisis and how they will inform our future behaviors as a global society. First and foremost, the pandemic has brought the critical link between human health and economic growth to the front and center. As countries around the world start being impacted by the economic consequences of the pandemic, it is fundamental that governments around the world, despite all the headwinds, continue to invest in their healthcare systems and infrastructure. Achieving universal health coverage is part of the United Nations Sustainable Development Goals, but we know that today almost half the world population still lacks access to essential health services. Second, we need to work together to build resilient and sustainable health systems and ensure health security. We have seen tensions between countries on the supply of medical products and equipment at the beginning of this crisis. Our industry has a key role to play in this topic, and during the peak of the crisis, we at Sanofi were able to increase production capacity and secure supply thanks to our global and diversified industrial network. We want to go a step further in Europe, where we intend to create a European and global champion dedicated to the production of active pharmaceutical ingredients. The crisis we face should not lead us to take further protectionist measures. What we need to ensure is building resilience and strategic health autonomy. Last, we need to clearly ask ourselves, what can we learn to ensure that we're never again caught off guard by a new pandemic? Pandemic preparedness was previously thought to be, prohibitively expensive and high risk, but it is now clear that it is an investment that must be made. The human and economic cost of a pandemic is far higher. I was pleased to hear European Commission President Ursula Van Der Lion making a series of important announcements along these lines in September, calling for a stronger European health union. And I want to thank her for her leadership. The plan to create a European BARDA is a positive first step. As a key French, European and global company, we will be pleased at Sanofi to collaborate with the EU, the institutions, and everybody supporting this ambition. Addressing a global audience today from Berlin, I know that countries like France and Germany are willing to play a key role in this debate for the continent. The stronger involvement of Europe into global health topics will not only benefit European citizens, but to the world at large. I've never lived through something as disruptive and as brutal as COVID-19 pandemic, nor would I believe that a virus could put more than half of the world's population in effective lockdown. It is too soon to assess the long-term implications that the COVID-19 pandemic will have on how we operate as companies, on the functioning of our healthcare systems, or societies overall. We will get through the pandemic together. And as we continue fighting against the virus, we need moments like the World Health Summit to discuss, exchange, be ambitious about the future of healthcare we want to shape for the next generations. Thank you for giving me the possibility to join such an impressive lineup of speakers. I wish you a very fruitful and productive summit. Thank you.
Thank you so much, Paul. Your success will be very important in order to defeat the coronavirus, and we are looking forward to the promising results. It is now my great pleasure, ladies and gentlemen, excellencies, dear friends, to introduce to you Winnie Bienima, the Executive Director of UNAIDS and Under-Secretary General of the United Nations. A passionate and long-standing champion of social justice and gender equality, Ms. Bienima leads the United Nations efforts to end the AIDS epidemic by 2030. Ms. Bienima has been an early champion of a people's vaccine against the coronavirus that is available and free of charge to everyone, everywhere. I personally had the great pleasure of meeting her in her home country, Uganda, and enjoyed her spirit and enthusiasm Please welcome with me the one and only Winnie Bienima.
Thank you. Thank you and congratulations on organizing this very important meeting, the World Health Summit. Excellencies, distinguished ladies and gentlemen, there is a wonderful German saying, der Gesunde weiß nicht, wie reich ist. I hope I got it right. The healthy one does not know how rich he or she is. There is nothing worth more than health. The COVID-19 crisis has shaken everyone and upended everything. We won't see a fast resumption of everyday life, and we won't be heading back to normal so soon. The good news that I have to share at this important summit is that the experience from the AIDS pandemic provides us hope. That hope, however, is not found merely in the passage of time or in easy tweaks. AIDS taught us, and COVID is reminding us, that only bold and radical policy action and major resource shifts can get us out of crises like this one. Nothing less than that can work. So here's some lessons also. First, a global pandemic must have a global solution. We learned that from AIDS. People were dying and the world was in despair until the United Nations brought the world together and agreed to have a global HIV response, which led to the successes we are seeing today. Even without a vaccine, even without a cure, we have 25 million people on life-saving HIV treatment, living full lives. I'd like to take this opportunity to thank Chancellor Angela Merkel and the German government for their global leadership in this crisis, recognizing that it's a global problem, needing a global solution, and standing in to lead a global solution. Second, we need, as governments and international institutions, to open space for communities. This is an important lesson from the HIV response, not only for the communities to express their concerns, but to be part of shaping what is done. The most important drivers of change leading us out of the AIDS catastrophe were not those in authority. They did their part. It was those most affected who brought ground level insight, who pioneered practical innovations, who spoke truth to power and held leaders to account. In a crisis, you need more community voice and power, not less. Affected communities sit at the heart of UNAIDS governance and at the core of our work. We are special in the United Nations system to have civil society sitting on our board and guiding our work, including people living with HIV. Their first message to us here at this summit, they've asked me to say to governments, to major stakeholders, open the doors. The third lesson, we need to organize the development and production of COVID vaccines, tests, and treatments, recognizing that they are global public goods. Those who do not learn history are doomed to repeat it. We saw this when antiretrovirals had been innovated, discovered, and were on the market. People in developing countries experienced 5 years at least, more than 10 million lives lost to HIV, as they waited because of the current system, monopolistic system that relies on patent hoarding and price gouging, that puts intellectual property protection over the right to life. We must change that. We must put people first. That's why we need a people's vaccine. I'm proud to be part of a diverse and global alliance calling for a people's vaccine. Together, we believe that there must be safe and effective vaccines for everyone. Vaccines that are fairly and speedily distributed across the world, free of charge, according to need, and not ability to pay. To do so, first, we need to maximize supply. No single pharma company can make enough vaccines for the world. We need to unlock huge manufacturing capacity for the vaccine. To do this, all pharma companies must openly share their know-how and technology for producing their vaccines free of patent and monopoly. This know-how and technology, which has been paid for by many rich governments, can then be shared with as many producers as possible. Once we have more producers, we have more doses, and there will be no need for this self-defeating vaccine bidding war in which the most at risk will always lose. For this to work, first of all, we have innovated. The WHO has shown us how access pools work. For example, with the medicines patent pool. We also welcome COVAX, another pool, but we need its spirit of solidarity to extend to sharing technology and intellectual property for the global public good. For this, we need more investment in vaccine manufacturing in more regions of the world to supply the people in this pandemic and be ready to serve them again in our next pandemic. The access to COVID-19 tools accelerator, ACT accelerator, has been set up on the understanding that no one is safe until everyone is safe. We need massive simultaneous production of vaccines, treatments, and tests across regions and across producers. The fourth lesson, we need to organize financing for healthcare in line with the recognition that health is a human right and a collective responsibility. People in developing countries spend $500 billion annually, over $80 per person, out of their own pockets to access health services. Millions of them sink into poverty because of paying for medicine, for treatment. User fees across most of the low-income countries and lower middle-income countries are the most regressive way of health financing. They are a tax on the sick that increases morbidity and mortality and exacerbates poverty and inequalities. And in this job crisis, access to health needs to be de-linked from formal employment. Fragmentation in healthcare delivery is expensive, it's inefficient, it's ineffective. Now is the time to step up public investment to ensure universal public healthcare that includes publicly funded, community-delivered services. We would need taxation, progressive taxation that is reasonable and affordable. We would need from businesses, and we would need the wealthiest individuals to take a higher burden of tax, progressive taxation. And of course, we would need to have the richer countries coming out in the spirit of global solidarity to support the strengthening of health systems in the developing countries. Many developing countries are spending today more on debt repayments than on health and education and social protection. That can't be a way out of a pandemic, because now they are also facing austerity with the economic destruction. The recent 6-month extension of the limited debt service sustainability initiative should be transformed into an agreement applicable to all developing countries and all types of lender, including multilateral and private lenders. We face a choice between life and debt. We need to look at other ways to expand the fiscal space for the developing countries to be able to cope with this pandemic. Fourth, fifth, and last, we need to challenge discrimination and exclusion and protect everyone's human rights. We can see how this pandemic has shown us how xenophobia, racism, bias, discrimination, abuse of human rights of minorities, LGBTI, sex workers, migrants. We've seen the most vulnerable people facing more persecution in the middle of a pandemic. We must stop this. We must assert human rights that are enshrined in the United Nations Convention. We can see how COVID has exacerbated crisis within crisis, worsening gender inequalities, exclusion from education for girls, child marriage is increasing. The COVID crisis risks undermining progress also on AIDS. HIV and COVID are two colliding epidemics that must be addressed together. I must insist on this because we're seeing in some countries desperate governments taking from one epidemic to fight another. This is not an answer. From the right to health to the right to education and the right to organize, all human rights must be at the heart of the response to the crisis and of ensuring public health. We can't beat COVID-19, we can't beat inequality, we can't finish the unfinished business of AIDS and also repair and restore the global economy, but only with a people-centered, public health, rights-based approach. And that requires boldness. Thank you so much for this opportunity.
Thank you so much, Winnie, for your great speech. And we are all very much looking forward to going back to Kampala, Uganda, for the next regional meeting of the World Health Summit, jointly with Charles Imigira, our Ugandan president, and the wonderful Lake of Victoria. Thank you so much. Now, Excellencies, ladies and gentlemen, dear friends, I'm happy to announce the next speaker, Nanette Cosero, the global president of Pfizer Vaccines. She is leading the development program and for innovative vaccines, and she is driving the prevention of several serious and life-threatening conditions. And of course, the focus today and hopefully, and I'm sure in the company, is the coronavirus and the vaccine against the coronavirus. Let us listen to Nanette Cosero.
Thank you to the World Health Summit chairs and committee for inviting me to join this esteemed group of international experts, and special thanks to Dr. Tedros and to President Steinmeier and the host organizing team. I am truly honored to be here with you today. Like many of the other speakers today, I see myself as a global citizen. I have lived and worked in different countries and cultures, and I've been privileged to spend time in nearly every corner of the world during my tenure at Pfizer. And this global perspective has never been more relevant or valuable than right now, the most pivotal moment I have experienced since I joined Pfizer more than 18 years ago. I know, as both a scientist and a healthcare business leader, that only with real global collaboration will we be able to solve the unprecedented crisis that the COVID-19 pandemic represents. At Pfizer, we recognized early that this was a global challenge unlike any other we have seen in recent history. And as one of the world's premier innovative biopharmaceutical companies, we immediately mobilized to research new medicines and vaccines to prevent infection and halt further spread of this disease. As our CEO, Albert Bourla, has said, if not us, then who? In March, less than a week after the WHO declared COVID-19 a global pandemic, we announced our partnership with BioNTech on a potential messenger RNA-based coronavirus vaccine. We also outlined a 5-point plan calling on members of the innovation ecosystem to unite with us in this fight. We committed to share data and insights, technical expertise, and manufacturing capacity, and we are delivering on each of these promises. The spirit of collaboration that has quickly evolved is a testament to the industry's willingness to step up and play our part to combat this terrible pandemic. I know my fellow speakers here today join me in understanding that safe and effective vaccines will be especially critical to defeating COVID-19 virus. We know this because vaccines are the single most innovation in the science of health, second only to clean water in reducing the global burden of infectious diseases. On average, it takes a decade to develop a vaccine. So I feel truly encouraged that according to the WHO, more than 40 COVID-19 vaccine candidates are in clinical evaluation. This is staggering progress made possible only through the dedication of thousands of scientists working together to conduct the clinical trials and the many thousands of people who volunteer to take part in the research. We owe each of them a great debt of gratitude. The phase 2/3 trial for our COVID-19 vaccine candidate involves more than 130 clinical trial sites and nearly 40,000 participants in 5 countries, including Germany. As we continue to move with speed and urgency, the safety and well-being of vaccinated individuals remains our most top priority. Together with 8 other companies, in September, we announced a historic pledge to uphold the integrity of the scientific process as we all work at the speed of science towards a potential global regulatory filings and approvals of the COVID-19 vaccines. We made it very clear that we will in no way and under no circumstances compromise safety standards. We will not cut any corners. It remains vitally important to reinforce this message, both as an industry and in partnership with governments, patients' organizations, and medical institutions. It's also important that we continue to prioritize vaccination against diseases that are already preventable to help protect the most vulnerable among us, from newborns in maternity hospitals to older adults for whom illnesses like seasonal flu and pneumococcal diseases pose a serious danger. Disruption of immunization services, even for brief periods, will result in more susceptible individuals and raise the likelihood of outbreaks for highly contagious diseases like measles. This is why guidance issued by the WHO specifies that immunization services are an essential component of health services and should be maintained as long as pandemic response measures allow it. I truly believe that following the impact of COVID-19, the value of prevention in healthcare is now better and more widely understood than ever before. So it's crucial that we build on this momentum to ensure disease prevention and that it becomes a higher priority for governments and healthcare systems across the world. This means greater investment in vaccine innovation and a renewed focus on routine vaccination schedules and vaccine uptake. Unfortunately, we still see many countries that vaccines are not being fully utilized to achieve their greatest impact across the life course. For instance, this year marks 10 years since the WHO and European Commission introduced flu vaccination coverage targets of 75% for people 65 years and older. However, only one country, South Korea, is meeting that target to date. To drive progress, we urge governments and health systems to prioritize and support access to existing adult vaccines for respiratory diseases. In particular, we recognize the importance of protecting those at higher risk of morbidity from infectious disease, those with a weakened immune system due to underlying medical conditions. With a possible reduction in hospitalizations from these respiratory infections, healthcare resources can be directed to the continued management of the pandemic, especially during the winter when pressure on health systems will peak. COVID-19 has shown a light on the need to establish effective health policies that focus specifically on the aging population and find new ways to address the common barriers that we know exist for older people to get vaccinated. For example, pharmacists have for years been an underutilized health resource in many countries. Today, they stand ready to take on vaccination to help protect their local communities and strengthen health systems capacity. This is in line with a call issued by the International Pharmaceutical Federation at the World Health Assembly to authorize expansion of pharmacists' scope of practice. We ask that governments update legal and regulatory requirements to enable pharmacists to vaccinate eligible adults against all vaccine-preventable respiratory diseases as recommended. Pharmacist-led efforts in the community have been shown to increase uptake, especially for older adults who face accessible issues or difficulties in scheduling appointments in other settings. I feel optimistic that doors are opening to have conversations about leveraging every tool at our disposal to combat these challenges at global health community. I'm inspired by the vision statement from the WHO New Immunization Agenda 2030, imagining a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. The time is now, and many of us head into winter season with a second wave of the pandemic emerging in many countries. 2020 is the year we have shown we are indeed stronger together. And I can help but wonder what strides we can make on other infectious diseases if we can sustain this high level of collaboration. If there's one message I like to leave everyone, a take-home message for today, is that prevention is everything. We must act now to establish policies and build infrastructure that work to prevent disease, to reduce health disparities today, and to build sustainability of our health systems in the future. Thank you for your attention and for the opportunity.
Thank you so much, Dr. Cosero. Yes, indeed, together we are stronger. Ladies and gentlemen, excellencies, dear friends, thank you so much for participating in this digital opening session of the World Health Summit 2020. It was different from previous years, but I believe we had extremely interesting messages to listen to and a lot of food for thought. In normal years, we would now have the great pleasure to invite you all for some good real food and drinks after the sessions. This was always an opportunity to meet old friends and new colleagues. This year is special, as we all know. Please join us again on Monday and on Tuesday for the program. Inspiring speakers, fruitful discussions will wait for you. See you virtually at the World Trade Summit 2020 tomorrow and the day after tomorrow. Thank you very much and good evening.